something that everybody says very casually nowadays. Work stress, home stress, so many types of stresses. So, doctor, in an Ayurvedic point of view, what is stress?
In current scenario, stress has become an inevitable part of an individual. So it is considered as an extra limb for a person. I think so. So in biological terms, stress can be considered as a thing which gives a threat to that individual. Maybe it may hamper the quality of life of that individual. He cannot concentrate on anything like that. One classification is eustress and distress. Eustress means how a person is coping with that situation. Right. For a normal individual, some eustress is needed. For example, if we consider an exam,
Yes.
some sort of stress is necessary. I think so. And if we come to that distress, it is hampering the individual. The quality of life will be hampered, everything like that. And this stress is the most underlying cause of many diseases like diabetes mellitus, thyroid issues, every metabolic like lifestyle disorders. The main cause is stress. I think so. In the Ayurvedic point of view, Acharya Charaka has mentioned that sahasa, in the term of sahasa is mentioned for stress, that it causes due to the lack of immunity or loss of immunity. It may develop so many infectious diseases or lifestyle diseases. Acharya also quote that overexertion is not allowed for each individual. It should be avoided like that.
Okay. So in Siddha also, is it very similar or quite different?
Actually, I would like to add some more things to what Doctor have already mentioned. Regarding stress, we can, in Siddha, there are two terms we used to use, like Kuraintha Uzhaipu, Adhiga Uzhaipu. Kuraintha Uzhaipu means it is somewhat similar to sedentary habit, and Adhiga Uzhaipu is overexertion. We will be exerting our physiological parameters to over its limit, like that. So both of these will cause disease. Particularly considering this stress, we can classify the stress for easy understanding into two. That is like physical stress and also psychological stress. There is physical stress also is there. Like if we are doing a hardest job for a long period of time, then that will also cause some sort of stress. And also psychological stress is also there. If we are exerting our mind beyond its limit, like somewhat every person is having some sort of tolerance level. They will be able to tolerate some sort of stress.
Yes.
But if we are moving beyond that, then that will also cause stress. So there are, for easy understanding, if we are classifying the stress into two, that will be like physical stress and psychological stress. Both of this will be resulting in somewhat similar sorts of complaints in our body. Both of them will be generating somewhat similar effects in our body.
The
manifestations will be more or less similar, like that. It even if it is a physical stress, that can cause psychological impacts, and even if it is a psychological stress, that will also cause some sort of physical stress also. Mm-hmm. And in management also, we have to think of that, because if a person is stressed physically, then we have to manage that stress psychologically. And if a person is psychologically stressed, and then we have to manage that through physical modes, like that. Because if a person is physically stressed, for example, he have done some sort of hardest job for a long period of time, then if we are advising him to do some sort of exercise to relieve the stress, that will be again causing excess stress. So that sort of physical management has to happen in psychological mode of stress.
In Ayurveda also, the body, the adhisthana of yoga or basis of yoga is both body and mind. Both are interconnected.
A holistic approach is there.
Yeah. When body is in a equilibrium state, the mind will also be in that state. Vice versa.
Yes. So there also, usually in stress management, if we are searching the web, nowadays it is a trend. If we are searching the web, then stress management will be like do some sort of exercise for some period of time, and do yoga. And these things have to be chosen by a doctor, I think so. Because stress management is different for different individuals, and their stress patterns will be different, and the root cause for that stress also will differ. Because some people will be stressed out because of their family. Some people will be stressed out because they are having some financial problems. Some other people will be stressed because they are having some stress from their work environment itself. So the management will be different. If you are directly doing some sort of like an over-the-counter medication or something like that, that will cause, I think, in some cases it will work. In some other cases, it can cause harm effects like that.
Okay. So, like you said, so maybe sleep is also a factor. So when there's too much stress, nobody can sleep well. So what do you think about sleep and stress also?
Sleep is also an important factor because it is somewhat more correlated to this stress also. Because if we are more stressed, the sleep apnea will occur. That the sleep will also be get affected. So a person to resuscitate from the stress, adequate sleep is required. And at the same time, excess stress is there, sleep will be deficient like that. So if we are managing the stress, I think the sleep will also get regulated, automatically regulated.
Right. So in Ayurveda, what can we do for inducing more sleep or regulating the sleep?
Yeah, in Ayurveda, we can classify the night time into 3. That is, 9 to 12 is considered as Kapha Kala. Vada, Pitta and Kapha in Ayurveda. That Kapha Kala is 9 to 12. After 12 p.m., Pitta and Vada comes. Normally, usually in Kapha Kala, normal sleep occurs. It is beneficial to sleep during that time. Before 11, one should sleep. That is the basic thing. After 12, it is the Pitta Kala and it may lead to severe problems like migraine, several types of headache. They cannot fall into sleep during that time. So better to avoid the screen time during that time and sleep before 11 and wake up at 6 a.m. It is and in home remedies we can do talam. In Ayurveda, the word is talam. We apply medicinal oil in the vertex of the head. It is a one remedy for inducing sleep. We can do it. Also, if in case of migraine type of headaches, we can apply Rasnadi Churna with Jambira sauce or lemon juice, medicinal paste. These are the several home remedies.
What about Siddha management, like medication and
Yes.
Treatments?
Actually, the concept is same in Siddha also.
Okay.
That classification of different kalas, like that night time into different periods, considering that Tridosha, what's the determination, and also the same way classification is there for morning times also. And considering I would like to add some more things to the points that already mentioned by the doctor. That a person, during the lifetime of a person, there are different stages. The first stage will be like developing stage, like we see babies. They are growing. That growth is happening more during night because other activities, because that growth itself is need a whole lot of energy. So during daytime, while we are consuming more energy, we are utilizing more energy, that growth pattern will be less. That growth growth quantity will be less. And at the same time, during night time, the growth will be progressing more. So for their ample growth during each age, they have to get ample sleep. Like that, they will be sleeping more, about 12 to 18 hours they will be sleeping. And towards the adulthood, we have to reduce the time we are sleeping. On an average, a person has to get about 6 to 8 hours of sleep for this resuscitation, because every activity will be inducing some sort of stress over body. And so to relieve from that stress, about 6 to 8 hours of sleep in average, not for all age groups. On average, every person has to get that type of sleep. And while during to the geriatric age, while their body is degrading more and more, they can sleep more because they need more time for resuscitation. That is regarding that sleep thing. And regarding home remedies, from our ancestral time onwards, we used to use jeeraga, cumin seeds. That will be roasted slightly and powdered, and that powder will be there at home, every home in Siddha culture or Tamil culture. And they will be taking a little of this cumin seed along with some honey twice daily, like that. So it will relieve that stress from our Annamaya Kosham or that digestive tract, so that we will get ample sleep. And another thing, as doctor already told, that screen time has to be reduced. Before going to sleep, about at least 1 hour before, we have to stop looking at the phone or looking at the laptop screen, like that. That will naturally induce more sleep. And also it will reduce the stress also.
So doctor, if a patient comes to you with stress, I need to control my stress, it's too much, I can't do anything anymore. So what mode of treatment will you do, or how will you treat this patient?
First of all, we want to say that they should follow a daily routine. Daily schedule must be planned for that. Correct diet plan and lifestyle modification should be advised. Some sort of pranayama, breathing exercise can be advised for them. Or body exercise, workout can be done so that they can be relaxed more. And also hearing music, what all things they are interested they can do in between. If they are washing clothes, they can hear music like that. They can enjoy whatever they are interested. And coming to the medication, internal medications are available like Kalyanaka Kashaya. They are classical type of medicines. Kalyanaka Krida can be given, Manasamitra Vadaga. And for inducing sleep, Sukha Nidra Churna are also available. And as already I mentioned about the Talam medicinal paste, and in our hospital we can do Chirodhara, Murtha Taila treatment. Murtha means head, that means Tala Podichil. Tala means head and Podichil means covering. Some medicinal paste is covered and the medicinal leaf or plantain leaf are covered, and we can do Tala Podichil, Chirodhara, Chirovasti, Nasya. So many treatments are available for relieving the stress. And thereby sleep will also be corrected. Insomnia conditions, psychosomatic disorders, everything can be corrected by these external therapies also.
So in Siddha also the medicines are similar, or are they different?
In Siddha purview, we will be first concentrating on what is the cause of that stress. If a patient comes to me, I will be first addressing him in a different way, like I will be asking him what is causing your stress. If it is something like some psychological sort of stress, I will be advising him, like most of the time people will be coming like they are being stressed due to their work. Like majority of the people coming stressed are from IT field. So they will be having stress due to their workload. That is the primary thing. So first advice will be, you have to take some sort of measures to address your stress at the time of work itself. Like if you are continuously doing the work for 20 minutes, take at least 5 minutes of break between your work time. And if you are so much loaded on the work, and you take at least once in a while, once in a week or something like that, whatever which is convenient for them, they can take at least 1 day off. And identify some method, like if you I have already mentioned, if it is a psychological stress, we can advise physical measures like gardening, some sort of home gardening, or some people will be liking cooking, some people will be liking, as already doctor mentioned, hearing music or watching movies, something like that. We have to address their stress in a pattern such that they can relieve the stress by themselves. And at the same time, the person has to, anyway he will be again exposed to that stress. First he or she has to find some way by which he can like that stress itself, like hardening. Reduce the stress level and getting scheduling, like Sakya. Like they will be more tolerant to that. They will be liking that. They will be some targets. They can schedule their task, and every evening looking at that schedule, achievement and everything, that will create some sort of energy to their mind also. That is considering, yes, they will that will boost them. That is considering that psychological part. On the other side, if they are stressed because of their physical activities, then we have to advise them to reduce the physical activities they are being engaged, such that their total energy level will be reduced only up to that 3/4 level. Again, they will have to remain that quarter part there, not until complete exhaustion. They do not continue the physical arduous job for the entire stretch of their tolerance level. Reduce that so that they can reduce that physical stress. And at the same time, along with these external managements, I would like to add one more thing, that we used to say that Varathu Kuritaravai Neimulukku, like that. That oil bath has to be taken at least once a week, like that. So that will reduce the entire stress, because the sudation, that Migu Viyarvai will be happening after each oil bath, and that stress will be relieved naturally. That's a good routine. That is why Siddha is more giving stress to Olukam. that that routine has to be planned. Like oil bath is advisable.
regimen.
Yes, that regimen has to be followed. And also 4 months once they have to do purgation therapy also if possible, like that. Otherwise they can choose the advice from a doctor and they can do it at least once a year, like that.
One more thing, in Ayurveda, Padabhyanga is also mentioned. Foot, applying oil on foot massage.
Other than on the vertex.
Yeah, Padabhyanga, it is Chakshushya, means it will promote the eyesight, sleep, all qualities are mentioned for that Abhyanga.
So foot massage can also.
Yeah, it can be also be applied along with the head massage.
As doctor already mentioned, that Suganidra Churnam, that main component in the churnam itself is Amukra, Vaidyasala somnifera. It is having that name itself, it is a good soporific. It helps in tranquilizing the mind. So that Vaidyasala somnifera, and also that another ingredient is Jadamanji, Nardostachys jadamanji, that is also having the same effect. So most of the herbal remedies that is pertain to regulating the stress and sleep apnea are some of the main important things are this Vaidyasala somnifera, and also the poppy seeds, kasagasa, and this Jadamanji, Nardostachys jadamanji. All these things can be used, and at the same time for relieving the stress from in out, like that, from inside to outside, we can choose this cumin seeds and also that I have already mentioned, like that.
From our discussion, it is clear that we can now manage stress and stress-induced sleeplessness very well.